prioritized for health workers, people who are sick, and their caregivers at home. In consideration of this, the US Centers for Disease Control and Prevention recommends the use of cloth face masks by the public to slow the spread of COVID 19. In consultation with the Ministry of Health, the Prime Minister of the Bahamas has requested that Bahamians wear cloth face masks outside their homes. Such masks can be utilized in places such as grocery stores and pharmacies. These masks can function to reduce the transfer of respiratory droplets by the wearer. While cloth masks offer some protection, you are more protected if you follow the recommended preventative measures in addition to wearing the cloth mask. These measures include staying at home, practicing physical distancing at least 6 feet apart from others, washing your hands often for at least 20 seconds, and not touching your face. Our healthcare providers need personal protective equipment while caring for patients. It is important to allow them to have the resources they need to function properly. If the public use cloth face masks, this reduces the chance of having a shortage of medical masks for the healthcare workers. Masks should be used safely and properly. Let us protect ourselves and each other.
This message brought to you by Bahamas Ministry of Health in conjunction with Guardian Radio.
This is Guardian Radio, your station for up-to-the-minute news, intelligent, interactive, and engaging conversation. 96.9 FM. The views and opinions of the hosts and guests are their own and do not necessarily reflect the position of the management and staff of Guardian Network.
You got to pay back. Revenge. I'm mad.
Good afternoon, Bahamas, and welcome to the Hit Back. I'm your host, Nahaja Black. It is a beautiful day here in the 242. I hope that everybody's doing well, that we're taking care of ourselves, that we're loving ourselves, being good to ourselves. We got a lot of news to talk about today. But before we get into, part of the news for the day, the thing that has been a part of the news for me was that I asked the question yesterday, something that came to mind. And the question that came to mind for me yesterday was that if the vaccine was available today, would you take it? If the vaccine was available today, would you take the vaccine? That's the question of the day. If it was available, would you take it? I asked that question on my Facebook page, and I can guarantee you that many of you said no. I was totally surprised by how many of you said no. By how many of you said that if there was a vaccine that was the vaccine that Pfizer now has, the vaccine that Mercer now has, that you are not interested in taking it. And my question was, why not? If vaccines are available, why not? Why aren't we willing to take it? That's the question of the day that I have. We have a lot of other things to address, of course, downsizing and whatnot, but I find it curious that we aren't interested in taking this vaccine and wanting to know why Bahamians are not there for that. Why aren't we there for that? Why aren't we interested in that particular part of this discussion? And because if you're not willing to take the vaccine, then well, if I'm the government and if I'm a health representative, a health worker, and the vaccine is available, we want to get the country back up and running. The vaccine is there, and you're not willing to take it. So then it makes you ask the question: how are we ever going to get back on track? And that's the question of the day. Would you take the vaccine? So I have joining me today on the show, on the Hit Back with Nahaja Black, live at Guardian 96.9 FM. Joining me today is none other than Dr. Susan Williams Lockhart to help me understand this process. What is it about the vaccine? Can we do without it? Right? Why? What sort of educational campaign needs to happen? Because one of the things that came out of it when I asked 100 people answered the survey, a little over 100 people asked this non-scientific survey. And when they answered it, the answer was yes, well, predominantly no. So about 65 to 70% said no, they wouldn't take it. And then the other said, well, I will take it, but there needs to be more data, there needs to be more evidence. And I'm sitting here looking at it and thinking to myself, okay, well, this is important. This is vital information. How do we even come close to getting people to wanting to take something? Or should we want to take this vaccine? We have the flu vaccine. And if I remember correctly, Dr. Williams Lockhart, who's coming on with us, one of the things that she shared was that with this flu vaccine, it's looking for the guy in the yellow, note, right? But the fella in a black Maserati by now, this flu is a different strain. So the one that we're getting this week isn't for the one that's today. The one that was, the vaccine we're taking for today is for the virus that was like 2 weeks ago. So this is where it's fascinating, and so I wanted to get her on because this vaccine talk is big, and let's have a chat with her. So without further ado, let's welcome to the show none other than Dr. Susan Williams Lockhart. Doc, how are you?
Why? Oh gosh, listen, I'm good. We were laughing. My children were like, "Mommy, you don't know the difference between the studio in the real life and online." I said, "Children, I have not gone anywhere for such a long time. I
That's
assume
right.
everything is online. It's an online studio,
That's
So
right.
we
Because
had a bit of a joke
because
about
one of the
that.
things we were wanting to do was to get you in studio. But listen, better safe than sorry. Let's stay apart, right? We're still doing
For right
great work apart.
now.
All right, Doc. So here's the thing: we've got Pfizer
Yeah,
and MRSA. We've got a vaccine, or both have vaccines. MRSA today, if I'm saying the name correctly, MRSA,
Moderna, I think
Moderna,
Moderna. Yeah,
Moderna.
yeah, Moderna.
Thank you. Moderna today is saying that their vaccine is 94.5% effective. Pfizer says theirs was 90%. The stock market is going crazy with excitement, and we are asking the question. I've asked this question. Many behemoths are not interested in this vaccine, and I wondered how difficult that is for healthcare workers. What were your thoughts on this vaccine, and should we? Is it okay for us to be skeptical?
Well, I would always say always be skeptical of anything that anybody is coming to give you. As people tell me all the time, I am very good at giving antibiotics, recommending surgery. But I remember one time I fell off a bicycle and I had to have a penicillin shot. My nurses laughed at me because I was running from one end of the treatment room to the other. When that nurse came with a needle, they say, "Oh, look at Williams." That was Williams then. "Look at Williams. She could take it, but she can't give it." "Doc, come now, come now. You got to have this thing." So I say that to say that when someone is giving you something, the person who is given always had an easier time than the person to whom the thing is being given.
That's
Because when
right.
it's being given, it's in your body. So I always say that we are very much of having educated and empowered patients. We have run medicine on a model that we are gods in the white jacket, we put the white coat on, and we are sent to celestial status, and we are here to tell you normal peons and mortals what we think you should do, but it's your body. And I'm like, no, 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 no. You and me will sit down together. Let us understand what this process is, and then we tell you what the options are. And then you decide based on those options and your understanding of the process for yourself what you will and what you will not do. Every choice has consequences, some good, some bad, and you have to decide what consequence you're willing to take up. That's not on me, that's on you. I've given you advice. Now it is up to you to make that decision. But having said that, I know that physicians and other medical people have a lot of weight because we should understand the science behind many of the choices, excuse me, that are being presented to the lay people. And that is where I think we have a responsibility to really educate and empower. People are scared. You have a thing and they tell you they're sending 30 million doses. It sounds as if the Germans invading over in Paradise Island once again, invasion by vaccine. So it has this sort of terrifying specter to it. So we have to break that down, right? Now, I went and I read because after we talked, and I sort of I put myself in a bubble because I was getting a little stressed out. So I say, something, I'm going to walk on the beach and pretend that COVID don't exist. Now, that might be
Exactly,
good
right?
for a week. I took a COVID break. I took a co-vacation, right, for a week, right? That's what I did, basically. But so I started back reading because you got to live in the world and your kids are here and you got to do what you need to be able to do at the point in time. Miss Black, I don't see you. Are you still hearing?
Yes, I'm still here.
Okay, beautiful, right. So what it is that they gave their vaccines, they had what you call a double-blind trial. So this is the phase 3 trials. So I had to talk to my good friend, Dr. Glennis Archibald, who's a researcher and works with these people in higher power things about it. And I said, remind me about how we do trials for vaccines. You have to understand that. First of all, you have the preclinical, which is exploratory, and the preclinical trials where they're giving it to animals to see, okay, what does this thing do? We're going to give it to you. We're going to give it to you in high doses for the animals. They're going to try some in primates that are like humans, some of the non-primates, or ferrets, the monkeys, who have immune systems maybe similar to those of a human being, and they're going to see, okay, does it affect the liver? Does it affect the kidney? We're going to cut you open. We're going to see what happens with you. So it's not nice for the animals, but you got to go through that phase. Then now you start off with the clinical trials. You start with the phase 1 trials, where you're giving it to small numbers of healthy people to see, okay, when I give it to you now, what's going to happen with you? Phase 2 trials, you increase your numbers and you're manipulating the doses now to see what happens. Now, from when I had remembered before in phase 1 and phase 2 trials, there were some questions because some people got ill, some people died. So it was like, oops, no, take it back to the drawing board once again. And the phase 3 clinical trials, which is the results of which they are speaking about, is when they have gotten lots of people. So I think it was 30,000 people in one, maybe 40,000 people in another. I think I looked at Pfizer's vaccine information. And in the 30,000 people that they gave it to, then they said that of those people going around the normal way, 95 people developed COVID. Now, not everyone got it. Some people they gave a dummy to, and some people they gave the actual vaccine to. Now, the people who got it didn't know whether they got the real vaccine or they got another one. I think they gave it to them 2 doses 1 month apart. So it comes as a 2-dose vaccine you take 1 month apart, right?
Right, that's what we heard.
Right. And so what they were saying is that I think for Pfizer, they said that 95 people got it. Of the 95 people who got the COVID, 90 of those were people who did not get the real vaccine. 5 of them were people who did. So that would certainly indicate that you have a high level of protection being proffered by the vaccine.
Hold on, say that again.
So
of
you
the
and me are in
95,
the right. So you and me are in the trial. 2 of us are in the trial. You get the dummy vaccine. I get the vaccine. Neither one of us knows what it is. Only the people doing the trial know who has gotten what. Right. So they do that with all the people in the trial. Some get the real thing, some don't. And then they observe them to see what happens afterwards. And then the people who were observed afterwards, 95 people altogether got COVID or got symptoms suggested of COVID. When they looked at the data on the 95 people, they found that 5 of those people, only 5 of the people who got the vaccine got the COVID-like symptoms. But the 90 people who did not get the vaccine developed the COVID-type symptoms. So based on that, they were suggesting this 95 to 90%, 95% protection rate or efficacy, which is one of the things. Now, having said that, there are a couple of things that go on inquiring minds want to know. So that sounds like great first results of the bat. That sounds like fantastic things to be. But you have to find out a couple of other things. First of all, those results have to be reviewed, I believe, by WHO and by other peer-reviewed people who sit and say, okay, you are a company, but you have a big dog in this race. If this works, your stock has shot through the roof, everything else like that as well. Now let's sit down and look at your data and let's see, can we reproduce it? Let's make sure that you followed all of the different epidemiological standards, all of the different standards of protocol that we normally request that you do a study for. And then now those bodies have to come back and report and say, okay, so this is the drug company saying, okay, yeah, we did it. And, I think Moderna came out and said theirs is 90. Pfizer came out and said we got a bigger pair. Theirs is 94. That type of way. The Russians are in the back with their Sputnik vaccine saying our vaccine works too. Ain't nobody checking for us. And I think the Chinese have something going on. The Chinese are like, well, ain't nobody want to hear what we have to say just because it's us, right? So there are many players in the race. When you look at it, a colleague of mine had posted up a list of different vaccines that you have, right? Different vaccines that you have, and there are several. Some of them didn't make it past the cut. Some of them, so it's not the end of the world to say, okay, that they have it and that's it right now. Now, the thing about it is that 2 things with this vaccine, again, to note. Number 1, they have not used a vaccine. This is the first time this type of technology has been used with a vaccine, right?
Hold on, Doc. Say this is the first time this type of technology, the technology being the RNA.
Yes, the mRNA vaccine. Now so let me look again with my cells. If you look at a cell, right? Let me see. Okay, my camera is there. So my cell, this is my cell, the cell membrane on the outside. The biggest part of the cell you have on the inside is this here called the nucleus, right? The nucleus essentially is the place where all the instructions for the rest of the cell are going to be given or the cell are going to be made. Now, the nucleus has in it only tiny pores and it has the DNA inside of it. The DNA is the deoxyribonucleic acid. That's what shows you how you talk, how you live, why you look like your mother, why you talk like your daddy, why you have green eyes like your great aunt, because you have the same DNA, right? Now, the DNA is a pattern. Now, inside of the cell, you have these little ribosomes. They make the proteins that produce the cell itself. The DNA has to give you the blueprint. Now, the DNA is too big to pass through the cells pores in the cell. So what normally happens, there's something called mRNA. It's like a messenger. It will go in, it will take a picture of the DNA and it will come back out and give it to the protein manufacturing areas in the cell itself.
Okay.
So the cell is a very fancy, different thing. So what they have done, because this is a virus, now typically it's difficult to get, as you said, to get a vaccine for a virus because virus mutate, they go inside cells, they hide, they do many other things as well, right? So what they have done in this case is that they went and they got part of the mRNA that codes for the virus, because the virus too has RNA in it. That's the virus's instruction manual. And part and parcel of the virus RNA, when the virus gets inside of the cell, the RNA core gets into the cell, goes into the nucleus, and then stages a hostile takeover. And then this cell, if it was a liver cell or a stomach cell making liver proteins or stomach acid, it stops doing that, and now it is co-opted into manufacturing virus particles. Right? So the virus is a very smart and sticky. So we talked all about what we need to do. We try to stop it attaching when it gets in there, stop it replicating, etc., etc., etc. Right? So what happens now in this event is that they've crafted that virus. They've taken part of the virus RNA, it's inside of the virus, taken a piece of it and put it onto what we call an adenovirus, which is a common cold virus, very common. It happens all the time, right? And then that virus now infects the cell. So it acts like a carrier for that part of the mRNA virus. It's a virus, it's a part of the mRNA that makes the mess, that tells you how to make the spike protein on the virus, right? So what will happen is that when this adenovirus takes it in, it infects the cell, it gets into here. So what will start happening is when that mRNA gets into the part of the cell, what it is going to happen is it's going to now make the cell start manufacturing those spike proteins, right? So it's going to manufacture the spike, not the entire virus, okay? Because if it manufactured the entire virus, then you would get the same sort of response from the body that you normally get. So what they're saying, and this is something that has been done before, right? This is something that we do with many different types of viruses. We take the part of the virus that will cause the immune system to respond, but not the part that would make us ill or kill us. We understand that? So we have to sort of attenuate it. So this is this has been done before with many different, but this is the first time now that the thing has to get into the cell of the body. The cell of the body has to actually make the protein and present it now to the immune system, present it now to the policeman, right? Normally, the thing is coming into the bloodstream, it's circling around. It normally does not have to get inside of the body cell for the body cell to do something or to produce something. Normally, you give the virus is in the blood floating around, and the immune cells say, hey, let's go for that. And that is how they train themselves on that particle or on that killed virus or on that attenuated virus. So when the immune cells train themselves on that, when the real virus or the real offender comes in, they're able to jump and go, right? So it's like if you're training, like when you're training a police dog, you put it with the man wrapped up in the plastic, or you put him on that's it's like a decoy. So a vaccine really is like a decoy for the immune system. It's a decoy because you want to train the immune system to be able to respond to that particular virus without the whole virus being there. Because if you got the whole virus being there, you'll get the effects of having the whole virus. You might live or you might die. You see what I'm saying to you? So this is the thing. But so that's not new. What is new is the way in which the mechanism, the way in which the thing is being carried and what is happening. And this is where people are like, well, we've not done this before. This is the first time. You need to make sure this thing is working properly. Right? So it's a messenger and mRNA virus vaccine, which we have not had before. I mean, so the technology. Yeah, go ahead.
What's out? If you're just tuning in, you're listening to the Hit Back with Nahaja Black, Dr. Susan Williams Lockhart joining me. We're talking a bit about the vaccines that have been produced, and obviously we're a long way from them being distributed, long way from them showing up here, right? But I'm curious, Doc, with what you said just now. What type of side effects what things could happen?
Well, the thing about it is, and I was talking with my good friend, Dr. Glynis Archibald, Daniel Archibald, who works with that. And she was reminding me, she says, Susan, listen to me, right? We are testing vaccines. The trials that we have are maybe 30,000, maybe 100,000 people, okay? Now, we do this, a vaccine is just another medication, it's just like another strategy for helping us, another treatment strategy. We do this with any drug that is brought to the market, be it an antihypertensive, be it an anti-arrhythmic drug, be it a drug for an antibiotic. it has to go through these same trials that the vaccine is going through. And she says, now you have to understand, you're testing this particular drug, or in this case, this vaccine, and maybe let's say 30,000, maybe let's say 300,000 people. Maybe in China, they have 300,000 people because they have more people than we do. So China and India probably could run. But now you are now taking the results that you get on this. Let's say 300,000 people, let's say it kills 1,000 people, right? And you might say, all right, well, it only kill 1,000 of you all, or something happened, your foot drop off, your leg drop off. Let's still run with it because it's the best thing that we have. But now you're extrapolating that on potentially 7 billion people. Okay, so 7 billion people, you're going to see some things that maybe you would not have seen before, you don't know. So this is why even in cases, and I was reminded that even in cases, let's say we had certain drugs, let's say there was a drug called Vioxx, which is a COX-2 inhibitor. That drug was touted as being the next best thing for sliced bread for older people with pain. It didn't cause problems with the stomach and bleeding and stuff like that. But then they found that when you gave it to enough older people and those who had cardiac issues, people started dying. So they had to come back to the drawing board, pull the approval back and say, we approve it for use only in these limited cases. Not everybody can go take this thing. Only these people under these circumstances can take it in this limited way. All right. So I think it's going to be something similar to this situation. When a drug or treatment strategy is approved, and I'm not an epidemiologist or a person that does a lot of research, it's from my reading and my understanding of it, right? When a drug or a treatment strategy is given approval by the regulatory bodies, it's not saying that there are no problems with it. It's not saying that no one died necessarily or had a serious. It's saying that they have looked at it and given benefit to risk consequences and consideration. They believe that this medication or that this treatment strategy can be employed for the benefit of people in the population. You understand what I'm saying?
Yes.
So whatever vaccine you get, you're going to have some side. You take the MMR vaccine. I was reading up on that. Whenever you get a drug or you buy something in the pharmacy, or even if you get a prescription drug, normally they will give you a printout. If you read that printout, you'd get terrified. I have a friend who tell me, he said to me when I was telling him, well, is this drug to that? He said, go home, buy a bottle of aspirin, pull out the insert they have in that and read it. He says, if you read that, you will never take aspirin again. Because it tells you you can die, it can kill you, you can get this, you can get that. The MMR vaccine tells you can get some bruising, you can get some itching, you can get some fever, but you could also get a bleeding reaction. You could also have a seizure as a result of that. You could also get a pneumonic process as a result of that. So I think, people have to look at it. You have to do your due diligence. And when people come, and I think though that vaccine is closer to here than you think it is, I think that vaccine is a little closer because for intents and purposes, we function in some ways like the 53rd state of the union. Now, people might get upset with me for saying that, but I'm just talking about geographically and in how we do commerce and we interact. Many Americans frequent here. We frequent many places in the US. I think the powers that be are going to want to ensure that whatever strategy is being employed, whatever trigger is going to be put, is going to be uniform across the board between ourselves and the people in the USA. And then likewise with the rest of the Caribbean. The Caribbean sits in that basin between North and South America. Many of us travel and move, and I don't sit at the top of the Caribbean Association of Regional Public Health or the PAHO or the WHO, but I would just think from a perspective of just economics and facility of ease and movement, that you would have to say, okay, let's all try to have some sort of uniform approach to what we are doing and uniform requirements to what we are going to do regarding this vaccine. You see what I'm saying to you?
Yeah, listen, first of all, someone texts and says, fantastic information explained by Dr. Williams Lockhart. So thank you for doing this, Doc. They wanted to share that with you. If you're just tuning in, you're listening to the Hit Back. We're talking about the vaccine, the possibility of a vaccine. I had Dr. Kevin Bethel on.
Yeah.
And he shared that the vaccine in and of itself is going to require some deep distribution or logistical, problem-solving skills when we talk about the need to keep it at a level that it's a super cold level that we've never heard of, a deep cold level, I think minus 180 or something crazy like that, to keep this vaccine in. What are your thoughts? Because that means to me, when I hear something like that, Dr. Williams Lockhart, is that it's going to be a while before we even get the vaccine, before it's a real thing even to us.
I think, to be honest with you though, because these guys, listen to me, the FDA were highly motivated because, when you sit down and you look at the figures for COVID, and I was saying, okay, let's stop focusing. Sometimes we miss the forest because of the trees. We focus in on the thing. Let's come back out and let's take a bird's eye view looking in. All right. COVID death rate apparently is 1 in 50 worldwide, something like that. Now, to be honest with you, And for here in the Bahamas, for instance, 157 people, I think the present date, have died of it, maybe 11 deaths under investigation. But let me tell you something. Do you know I did the lecture on breast cancer? I was very honored to do that for the people at the Cleveland clinics 2 or 3 Saturdays ago. Do you know in 2018, 200 people died of breast cancer? In
Oh, wow.
2018, yeah, and it was like, well, they got a breast cancer. Okay, then, well, okay,
That's
let's
it.
have the potluck or whatever.
Yeah.
So many of us are dying from chronic non-communicable diseases at a higher rate than what COVID is. And this is why some people who are the COVID skeptics are like, why are we making all this big fuss, shutting down the economy, doing all of this? And that is the result of it potentially could be. Now, I don't quite agree with that. I don't quite agree with that situation, because I do think you have to be careful, because you don't know who will get it and what the end result will be as a result of it.
Exactly.
But, so when you think about it from that perspective, right? Okay, there are more people that have that effect than the rest, but those people who die from breast cancer does not shut down economy, close down schools, cause you to have to wear a mask everywhere, so there are some differences in terms of it. And I think the FDA and these regulatory bodies have been highly motivated to fast track this. Normally, people are looking at it because a fast vaccine or a quick vaccine is normally an oxymoron in science. Many vaccines take sometimes 4 years to come to table.
Exactly.
Right?
Exactly.
And so when you're talking about in a year, because now we heard about COVID last year in November, it was probably not until January, I want to say, if my figures are correct, January or late February, I think it might be January, where the WHO said, okay, it's a pandemic. Now let's get off to the races and go. So you're saying that in less than a year, you have gone through preclinical animal trials, phase 1, phase 2, phase 3. That song like is, a bit of a shotgun wedding now.
That's what,
like the baby on the way. Let's make this thing look good, right?
Right.
So this is why people, I think, and rightly so, there is right to be concerned about how that is going to happen. But the thing is that you're putting up, consequence to benefit, as with everything else, risk to benefit. What is the risk? What is the benefit? You're asking me personally if I would take the vaccine. I tell you, I would want to ask some questions first. I'd want to see some information first. I would want to go read some studies first, right? And because for myself, I will tell you, I don't recommend anything to anybody that I'm not willing to do myself. Now, if they come and they say, Doc, that is what we want to do, I will say, okay, now I would not do it, but let me explain to you the pros and the cons of it, and you now make your decision, but you're understanding what you're signing on for. I'm big in terms of that education and empowerment situations as it at the end of the time period. I'm seeing somebody talking about on dry ice. So yeah, the point of the storage situation, I think they were saying that you can do that. You can get there's a difference between the Pfizer and the Moderna one. I would have to look at that.
And it's mentioning Emory in Atlanta today announced their vaccine.
Yes, it's going to not require that amount in terms. So the logistics of that will be a little bit easier in terms of how you're going to do it and how you're going to run it. But certainly certain countries, those I think that have socialized medicine, that are accustomed to already giving out from one fixed place or unit, they're accustomed to distributing care or distributing medication, they are probably going to be further ahead of us than those of us who more or less run a private, public, sort of you get what you pay for sort of situation and scenario. And I mean, having said that, our public health system here runs a fantastic vaccinating campaign. I can't think it was Bastian and those ladies down at the, I think, Flamingo Gardens. Is it the one on Carmichael Road? So Fleming Street. Is it Fleming or Flamingo? I think Flamingo Gardens. That's where the National Vaccine Center is. They do a fantastic job with the resources that we have. But, so I think the vaccine may be closer than a little while away. Because Americans like to travel, do vacations. We also need, for right now, until we get some of the economies and other things up and going, we're going to need to kind of like have that tourist income coming still.
Let me ask you,
stabilize us.
Let me ask you, Doc, because what I've heard, a lot of folks are saying, listen, let the Americas, let the Americans, let the Canadians, let everybody else really test it and try it out. For the mere fact that this sort of technology, as you said, it hasn't been tried before, really. Where I'm curious is that I think the number one challenge is going to be for us, because I do believe my physicians, I believe all of as Bahamians, I believe that no one is going to force anyone to take a vaccine. It's not going to be forced. There may be some stipulations later on for U.S. travel. Maybe the U.S. Customs will say, listen, immigration say, if you want to come to the U.S., you may need to prove that you've taken a vaccine, something like that. And that may drive us to take the vaccine more so than any forced stipulation. Because I know that many Bahamians don't take the flu shot. Many Americans don't take the flu shot. It's not something that we're, we just take our Cersei and whatnot. and we're good to go. How do you believe that we will have to have some form of education campaign?
I think definitely, because I think even among the physicians, and I mean, when you sit down and talk to them, I belong to two groups. There may be the Medical Association of the Bahamas group, and I talk, and that's basically physicians, 160 of us, we sit down, we talk, we discuss, sometimes a little coolly, sometimes a little more hotly than others, and I enjoy that because it gives you an idea as to what people are thinking. And I belong to a group which made up of physicians from my graduating class, and we are all over the world. Some are in Malaysia, Australia, the US. So we are talking about our different experiences. And you certainly do have to bring, and like when the news broke about the studies, the gentleman who was in Malaysia was giving us some information from that side of the world, which I really appreciate. And some of the people in Jamaica were saying, yes, but where are the peer-reviewed studies? Meaning to say that physicians and other people who do that same type of work have to sit down now and sit and say, okay, you've done it. Let me look at it. Let me see whether it's good, bad, or ugly. Is it reproducible? Have you done the right thing? You don't let those clanging of those stock market bells sort of tell you, put
That's
more
right.
money on this particular dog in the race. See, so that was my thing about it, is that I come from the old school where less is more. If you could drink either Edo and the avocado and instead of taking the anti-cholesterol medication, like the soluble fiber, take your cholesterol down. I'm like, okay, do that. But we are not there, and overlying, we can sit down and get into the specifics of the talking of the vaccine. But as I tell people, I said I didn't make it, so I need to see what data they are going to present out. And I can tell you, though, that I trust our physicians. I know people saying, the government just going to tell you, take this, and we want all of them in Parliament to take it on their hip first, and then we get it afterwards.
Yes.
Right? Well, we may have to throw some leadership there. Certainly, if we are recommending that we take something, I would think it would behoove us to say, okay, we are going to show leadership and go get the vaccine first before I tell anyone. Some of my colleagues have said, I'll take it without a heartbeat. I'm saying my thing is, I am not anti-vaccine. As I tell you, in my household, 4 of us get the vaccine. My husband is a man from Ragged Island. He said he ain't taking no vaccine. He ain't going to do it. And all his family is like that. So I think that's just a genetic thing for them. But I take it and I give it to the kids because and as you said, some people do it, some don't, okay? And as you know, the flu vaccine, it gives you 40 to 60% effective protection because the vaccine mutates. This new vaccine, so some viruses are very stable viruses, right? Like MMR viruses, they've been the same from, I want to tell you, last 100 years. They have not mutated greatly. So the MMR, it's predictable. It's going to give you this coverage, right? Certain other viruses, like the flu virus, the influenza virus, right? That mutates all over the place. Sometimes he's type A, sometimes he's type B, sometimes he put on a yellow jacket, sometimes. So when you get the vaccine, it's going to only give you maybe 40 to 60%, but that's better than nothing. That's what I say. If you can attenuate the results of it down. So with this new vaccine, what they are saying, a couple of the questions, they're saying, all right, it works in these volunteers. It's working in these trials so far. But how is it going to work in, let's say, elderly people with chronic non-communicable conditions? How is it going to work then? How long is the protection going to last? Will it be okay for you to get it once, 2 times, 1 month apart every year, every 6 months? How is it going to go? Because it has to train your, you have what you do when you get the vaccine in, you get 2 types of cells, the T cells. The T cells are part of your defense system, right? And what will happen now is that they have to remember the virus. So when we were talking about it, the spike protein comes out of your cell into your body. The spike protein comes out of the cell into the body, right? And when the spike proteins come out, the T cells say, oh, that's a foreigner, that's an invader. Let's go and take it out.
Right.
So the T cells learn it, and the T cells, and there is a clone of the cells called the memory T cells and the memory B cells. The B cells are like the big boys. I call them the big boys. They do chemical warfare. They produce these antibodies that everybody talks about. And these antibodies, chemicals are going to go on. They're going to take out the virus. The T cells are the big boy, like Mr. T, like Mr. T in what is the name of that show? I can't remember.
A-Team.
A-Team, right. T cells are just like Mr. T. They're these big guys, and they go in hand-to-hand combat. They're going to go in like kamikazes, and they're going to kill this virus, and in themselves get killed. So these are the immune system that it's our acquired immune system, not the one that we are born with, but they have to learn it. It's like your defense forces, it's like your SEALs or your Navy SEALs or your special forces people, right?
Yeah,
okay. Oh Lord, Miss Smith, give it to Mr. Minnis and his entire generation. That song bad because listen here, I am Dr. Minnis generation too. I think I know nothing.
You don't do nothing wrong, eh?
No, I know nothing wrong. No, as I tell you, I may still take it. I see he said I will take the Emory vaccine. Well, so okay. right?
We have some text here. This is a good one. Good info, but how can a vaccine be 94% effective if you only had clinical trials on a small amount of humans? Also, how many primates numerically they use in the vivo studies? It says,
Okay, so
oh, and let me just, Dr. Fauci's investments. Okay. In
mm,
Moderna and okay. All right.
mm.
So let's go with the first part.
All
All
right.
right. Go ahead.
So I hear what you're saying, and I agree with you. They cut it short. They did not use as many as they normally would use. They did not, because in terms interest of time. So they did the minimum, and they said, okay, there's a range. There's this amount, and then there's that amount, right? So they went with this amount. That's what they did. Let's be honest about it, right? But again, that's what we've been doing with COVID so far. Normally, with all these tests and treatments, we test up the wazoo. No, we haven't done that. We say, okay, we think it work, go for yourself, but be aware of what, caveat emptor, buyer beware. That's one
Yeah.
of the things. Mhm.
Someone else and says the conversation of many against vaccines of many against vaccines is because of the many dangers revealed about vaccinations. For example, carcinogenic, I guess, agents in the late 50s to 60s, and in recent years, the proposed concerns of the relation of vaccines to autism. It is hard to accept such an experimental vaccine under such rushed circumstances, and I think that's the theme. The theme is that look, this for me, I look at it this way. I'm not an anti-vaxxer, doc. I'm someone who my kids are vaccinated. I got vaccinated. I'm not an anti-vaxxer. Unnecessary vaccines, things that I don't have to, then whatever. But for me, this will be the case where this is technology, like you've mentioned, others have mentioned, when we're talking about mRNA. Like I'm just learning about RNA, right? Now you're telling me there's an M one, and that this is tech that we've never used before to fight a virus that we haven't seen like this before. Maybe in the way it mutates, in the way it behaves. But we've seen coronaviruses before. 90% of us recover. 90+% of us recover. And of course, we don't know how it will react to me if I get it. If I get it, I might have a severe reaction compared to my neighbor, my sister, my husband. He might be asymptomatic and I might be in the hospital. So that's where the disparity comes in and the concern comes in. This rushed effort on a vaccine, I understand that there's a need to do it. Like we want to get all back to normal. I feel like there needs to be a deeper uh, you know, conversation and educational campaign on saying, listen, man, yes, you're concerned now. What happens in the long term? What happens to you with this technology in 5 years? Is there a mutation in the DNA? And these are questions that can't be answered today, just like I guess they weren't answered when we
Well,
needed the polio vaccine.
but you know what I will tell you though, sometimes, and I mean, we have gotten science bound, and I like that now. But what I like about medicine, and I think I like about science, is science and medicine has a way of surprising you at times, and you say, oh my goodness, I didn't know that would work. And I would tell you, from as far back, because I wanted to be an astronaut one time. My poor father, I put him try, I said, I'm going to the moon. And my daddy was like, oh, no way. I couldn't do that right then. But I remember at one point in time, they said it was impossible to do it. And then they did, and if you ever looked at that show Hidden Figures, my daughters love it with
I
that.
love
That lady,
that. Favorite
she died. She had to sit down with a cat with figures. It was like, wow, that girl, and with so many other things underlying that. And the man was looking at her and saying, no, I'm putting my life, I'm going on this sling around the moon, because is it going to work? And he told him, only if that little black girl says it'll work, I'll go, because the rest of you all just want glory, but it's my butt on the line out there. And she came and she was on the thing and she worked it out with, and she said, yes, it will. And he said, okay, I'll do it because of you. So sometimes what I'm saying is that you have to have that attitude to it sometimes now, not unknowingly, not recklessly, but also sitting down and considering it at the end of the day. So I would tell people, I think what has happened in the vaccine, like so many other drugs and so many other things with COVID, it has gotten politicized. That people are saying not that they're against necessarily what the vaccine may be, but they're against the people who are proposing it. They're against, so there's no objectivity. It's the same thing like what I feel happened here with the people who were proposing the antigen test, the Living with COVID Coalition. I thought they made an excellent effort, and I think that is where we have to do things. We have to move from the ground up. We can't wait for the government to bring everything. We got to sometimes say, okay, let's do it.
Oh, and that would lead me to a great question to you about the antigen test. But so finish your thought there, and then I'll ask that question.
So, but what they had not done, it depends upon who brings the technology forward. Because there were concerns when the first time I'm seeing it is I'm seeing a non-medical person displaying for people on national news how this thing is to be run.
That's
and I'm
right.
like, I have issues with that because that's not safe. And I understand. But at the same time, when you are telling people do this, not that. You must still recognize that the effort was a good effort. You must still commend that effort, because people, you don't want to slap them down and say, okay, go away and never come back. No, because the government cannot do anything. So it is the way in which something is introduced that oftentimes, as they say, you don't have a second
First
time to make a
impression.
good first. Yes.
First
So the
impression.
first impression is like people's gut feeling, man, when they told me about that, I wasn't for that, I didn't like them people who was talking about that. The same thing people talking about, they say Dr. Fauci. For me, one of the things that I had to work against was Mr. Gates was proposing the vaccine. And I say, hold on now. This is not the type of virus he trained to treat. When he
That's
went
right.
medical school, he's
That's
a tech
right.
genius. And he could do anything on my computer, and I'll go with him. But this now medication now.
That's right.
Where's
That's right.
his? So
Where's his
sometimes
expertise and his
people,
agenda? Right.
yes, people in their enthusiasm to bring something. I want to tell you. You got to make sure the message is coming through the right. But having said that, a broke clock is right 2 times a day, right? It's still right.
So we might be looking at something that, and I guess your advice is, before you just abjectly say no, let's look at it and say, okay, but it could be a yes. Let's look at the data. Let's look at the.
Yes, let them bring the data. They're crowing, they're talking. It's the latest thing. And I guess, having been a physician, we often sit down when they come up with the latest thing, the latest drug, the latest process that.
And you guys are used to that, because you guys get hit by medical agents all the time.
Yeah, and many times, I mean, to say some of them, sometimes when you look at it, because the drug reps, and you have to sometimes balance that. Drug reps are great because they come and they bring the stuff to you. I say, I didn't know they had one like that. I wanted a combination of that. You got it? All right, I'm going to try it and see. And now they have skin in the game as well. So you have to often know, okay, I'm going to use this. And we sometimes would use one from this one from that one from the next one, so that we maintain objectivity, right? We don't sell out to say, okay, well, that's a Pfizer doctor. Anything with Pfizer they say is good. No. You still maintain your objectivity and your professionalism. And I think this is what, but I think, having said everything, and listen, this has been a very tough process for everybody. We didn't know, nobody had this under lock. The big countries that we normally look forward to, the UK, and they're right now going back in lockdown. I think when last I heard,
places.
Yeah, they was in lockdown, man. We in lockup. We people on the beach, man. So listen here, right?
We
little better
have a
enough.
party in Bimini.
Girl, now listen here. You need to watch yourself now, because Dr. Minis will say, lock them back down.
Lock down. Yeah, man.
Lock them back down, right? So what I'm saying is, we have to give a little bit in the process. Before I was like, no, Bill Gates said it. No, I don't like. He's a special advisor to the WHO. No, I don't like none of them. I don't like them. But at the end of it, when you sit down and say, okay, forget whose name is on the top of the paper, read the scientific information. You say, something, maybe that might work. It's odd, but remember now, many things else. The man to the moon experiment. When the people first discovered, the man who discovered vaccines overall, they said it was an African slave who told him. It's a fellow, I think it was an African slave who told him that, if you take a little bit of the cowpox and scratches and put it under your skin, you'll be okay. When he told the other people that, who were primarily white, I think, Edward Jenner, that's his name, Edward Jenner, in 17th century England, they told him, you are crazy. The black man tell you that, and that's what you can go do. You crazy. But at the end of the time, he and his sons didn't die in the smallpox. And that was how we started off vaccination. Because listen now, remember now, all a vaccine is doing is helping, it's manipulating your immune system. That's all it's doing. Now, you could do something similar. I see Ms. Albury says she can take her bush medicine and watch the process. Well, okay. That also, too, helps you, right? Because all of the vitamins and the other things that we've been talking about, the vitamin D, the vitamin C, the vitamin
Fever grass,
D.
because boy, I just want to shout out my neighbor. My neighbor showed up and brought me some fever grass, and I planted my fever grass. Shout out to my good neighbor Indira. Sorry, I had to throw that in there.
No, excellent. So you have some flavonoids, you have some bioflavonoids, you have some anthocyanins, right? Where you take, I discovered walking along the beach, right? The sea grapes. Sea grapes are an excellent source. That's why people, if they have to live in the bush or go forage, is good. Excellent source of zinc, of fats, of good fats, right? Of protein, of calcium, of selenium, of many things which are important for. So all you are doing, because when you take those things, you are helping your immune system work better, right? So a vaccine is a part and parcel of it. Prime Minister Menace once said, he said, use the mask. The mask in itself is like a mini vaccine. And people are like, what he's really saying is that when you use the mask, what happens? Your exposure, instead of giving your body a hit of vaccine all at once, you're getting maybe tiny bits of it in, which are not enough to make you ill, but it is enough to stimulate your immune system to do it.
Dr. Bethel said that it is a good form of inoculation, the mask in and of itself.
Yeah.
Dr. Susan Williams Lockhart, thank you so much. Somebody asked, and I want to get a quick answer from you. Can you use the seed from the avocado to make a tea?
Use the seed from the avocado. I have never
heard of that one.
But I know that they were saying that this B17 vitamin was in the avocado. And I guess some seeds are known to have a level of cyanide in them. But I would think you probably could do it. People eat the avocado seeds. I mean, I haven't heard of it, but I guess it would be all right. You could eat the avocado, definitely, though. That one I know for a fact.
That would be no for sure. Dr. Susan Williams Lockhart, Doc, thank you so much. I appreciate the time. It's always a pleasure to have you on the show.
Yeah, man, always. So I would say that, listen, don't be so. I would tell people it's not something, as somebody once said, I don't want to be the first one in the line to get it, and I don't want to be the last one either. Put me somewhere in the middle. But I would tell people, educate and read and listen to what your physicians are saying to you. But educate yourself as well, too. Right? Yeah. That's what I think. All right?
Thank you so much, Doc. I appreciate you. You're listening to the Hit Back with Nahaja Black. That was Dr. Susan Williams Lockhart joining us. We're going to get news, and then when we come back, my good friend Sia Nuri joins me. I want to hear from you. Will you be taking the vaccine? Are you open to taking the vaccine after you heard all of that? Yay or nay? We'll be back right after this.
This is Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
You're listening to the Guardian News Network. Good afternoon, everyone. I'm Taylor Ferguson. Here's what's making news. Thank you so much for tuning in. You're listening to the Guardian News Network. Good afternoon, everyone. I'm Taylor Ferguson. Here's what's making news. Thank you for tuning in. Prime Minister Dr. Hubert Minnis slamming reports of large social gatherings as some Family Island communities see an increase in COVID-19 cases.
There's always a possibility that one who was attending such an event could have been a spreader, super spreader. And therefore, my message to the Bahamian populace at this time, all those individuals who had attended such events, you must assume that they are potentially infected. And I would advise them to go into self-quarantine.
He's also warning Bahamians against unnecessary travel at this time.
One of the reports we're getting back, a lot of Bahamians are visiting the neighbors to the north, and they're visiting flea markets and other stores, and they're not wearing any mask because that is not a requirement there.
Police have already begun to identify and fine dozens of persons who violated the emergency order Saturday night by attending that crowded party. In a statement, police said work continues to identify the others and serve them in regards to not social distancing and failing to wear masks. Bimini yesterday recorded 11 new cases of COVID-19, bringing the island's total cases to 74 since the start of the pandemic. Well, Dr. Minnis also asked about an increase in cases on Grand Bahama. In October, the island recorded 114 COVID-19 cases. In just 2 weeks in November, 155 cases recorded. For now, Dr. Minnis says officials are trying to determine whether there is community spread. National Security Minister Marvin Dames calling it unfortunate that the COVID-19 citations of individuals are making it onto their police records. He said it was never government's intention for persons to acquire a criminal record of any sort, but to act as a deterrent from breaking COVID restrictions. Dames said they are working along with the Attorney General's office to get those records cleared. And that's what's making news. I'm Taylor Ferguson. AP News is coming up next.
We've made the switch. Commonwealth Bank now offers safer and more secure online banking with 24-hour one-time password authentication. OTP is an alphanumeric series of characters that authenticates the user for each cash transaction. A new and unique password that's secure every single time. For immediate assistance, please visit your home branch or contact the call center at 242-502-6159. For further information, visit our website at www.combankltd.com. Commonwealth Bank, leader in personal banking services.
Coronavirus update. I'm Ed Donahue with an AP News Minute. Stocks finished higher, the Dow up 470 points, in part because of news from Moderna. The company says its coronavirus vaccine is in line to be 94% effective. The nation's top infectious disease specialist, Dr. Anthony Fauci, says his initial expectations for this vaccine were low.
I said I would be satisfied with a 70-75% efficacy, and that something like a 95% was really aspirational. We would like to have seen it, but it was aspirational. Well, our aspirations have been met.
Pfizer reported similar results for its vaccine candidate. President-elect Joe Biden is encouraged about these vaccine developments.
I think we're on a clear path now.
Biden says President Trump needs to start the transition, especially on coronavirus response.
More people may die if we don't coordinate.
The president-elect says he hopes the president will be mildly more enlightened before Inauguration Day. I'm Ed Donahue.
This is Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
Over 60 years ago, we started as an insurance company to put people first. Today, that mission has never been more important. Colonial, Atlantic Medical, Security in General, and NEBA are coming together and are now called CG Atlantic. Though our names have changed, our purpose hasn't. We're still the same people-first company we've always been. And we're here for you, stronger than ever. CG Atlantic.
Helping out each other, family and everybody. It's a simple act of kindness with you, me, and RBC.
RBC wants to spread acts of kindness during this festive season. One simple act of kindness for our friends, co-workers, and communities can cause the brightest smile. Help a stranger, give a food basket, or call an elderly person. Share your stories at facebook.com/RBC Caribbean.
Acts of kindness, RBC.
Cancer is smart. It pushes us. We push back. Challenging conventional thinking, finding smarter solutions. That's what makes Cancer Treatment Centers of America one of the leaders in precision cancer treatment, using tools like advanced genomic testing and immunotherapy to bring more options to our patients. Cancer Treatment Centers of America. We're not just fighting cancer anymore. We're outsmarting it. Visit cancercenter.com/outsmart to learn more.
This is Guardian Radio 96.9 FM. Fresh news, smart talk, all day.
And we're back. You're listening to the Hit Back with Nahaja Black. Hope everybody's doing well, taking care of yourself, loving yourself. Special guest, my good friend C.A. Nuri is in studio. C.A., say hello.
Hello.
What's up, buddy? Okay, he's over in the one straight in the corner there. All right. Well, I hope that everybody's doing well, taking care of yourself, loving yourself, all of that good stuff, right? Hope that everybody's, on the up and up. But oh, right. Yeah. Don't say that loud, because then that'll be the end of me. Right. Right, Ali? That would be the end of me. Turn down your laptop, buddy. So be an extra. So, anyways, I hope that everybody's doing well, that you're taking care of yourself. We got a lot to talk about today. Party in Bimini, man. Listen. To all of my folks who are Biminites and are partying and having a grand old time, I'm just saying I'm glad it ain't us. Can I just say, New Providence people, it wasn't us. It wasn't us. Okay, that's them. That's a small island just getting off on themselves. And who records? This is the rule. The rule is that you cannot. How is it that in this day and age, as adults, that we're still having parties where there are not party rules? Party rules as you cannot come to this party with what you call it, Cecil? With any form of any recording device. Like, why do we need to have recording devices now? I don't know. Can we not party without it? There should be a whole thing. Young people know the rules, Young people have some sort of sense of rules, right? The young people will go ahead and have a party, and American young people, I don't know about ours. Ours a little special. We ain't learning that.
We ontologically Americans.
Are we?
Yeah, man.
Come a little closer to the mic. I can barely hear you.
Oh.
There you go. Now put your headphones on so we can you can hear yourself better. The issue is, can you not have a party and then tell everyone, I think it's an issue of trust. I think it might be a matter of trust. It might be a matter of trust. Because I think that there are a lot of folks who may not trust that if I put my phone in a bag, that you'll give me my phone back.
Phones tend to go missing.
Y'all afraid for folks will steal your stuff. That's what you're afraid of. Why are we afraid of folks stealing your phone? What kind of parties y'all go into?
But we do have a number of voyeurs into the Bahamas who like to record everything, from private situations to recording other people who we don't know. We are a society who likes to record and report the news.
Oh, yeah?
Yeah.
Huh?
So that the person there wanted to be the person to report that we party in big time in Bimini. We're not like those Nassau people who are in lockdown. So it's something to brag.
People could do better. We could do
something
better.
to taunt about.
My God.
And they were delighted to let the world know, let Nassauvians and Grand Bahamians, the Lutrians know that they ain't like us. They ain't in lockdown.
Oh, yeah.
And what made me smile is Bimini is only so big. When Church of God turn on their music, the whole island knows, right? With whatever pastor preaching, the whole island knows, because it reverberates through the whole island. I want to know, where was the constable? Where was
he was shocked.
He was sleeping?
He was shocked that this party happened.
It happened.
The whole thing with the party even happening had him very perplexed.
That the police station was next door.
Nope, man, listen. Don't worry about this. This island is bigger when parties happen, okay? And I just want all my Biminites to know, we see you, boo. And it ain't happening in New Providence. They ain't catch us this lap, okay? And we ain't giving, now mind you, we do have a way of giving honorary awards to folks who've been to COVID parties, but that ain't no problem. That ain't no big deal around here. Someone says, Nahaja, there's a song like Stevie S says, Lay Low on Bimini. But Arlie, we got that one? Lay Low on Bimini by Stevie S? Arlie ain't even checking for me. Arlie ain't checking for me. Why Arlie ain't checking for me? This is tough times. Oh, well. Anyways, so if you are in Bimini now, you're getting locked up. They ain't get locked up yet?
No, not yet. I think right now the competent authority. No, the fines is a given, and that's because the police in charge of the island was shamed, because he got that phone call from Roll and said, where were you?
But I mean, but did he not see the videos traveling on social media before the commissioner called it?
I think he panicked. And
I think he would have, I feel for the good man, because he could have been out to sea.
Yeah.
He could have been out to sea during the party in Bimini, right? He could have been out to sea. And these things happen when you go out to sea and you come back and whoop, there it is. There's news, right? Now, what I liked about the video, I must say, was that the Biminites felt a need to state that this was Bimini.
Yes.
And that Nassau lockdown.
Yes. They're not driftwood.
But not Bimini. But they lock up
I tell you, listen, man, why are we having parties with phones? I don't understand. I don't even understand. I feel no sense of sympathy for anyone who now has parties in any business place where you're grown adults and you want to shake your tail feather, but you know judgment coming. You should have a party bag. You should have a bag for phones. And you should not allow people to come on these things with their, this is just, I'm just saying, this is what I'm saying. I'm just saying, I wouldn't have had that party.
Yeah.
I just wouldn't. I wouldn't.
Because you're from Nassau.
Yes, you're right.
You're from Nassau.
Is that what were you about to sing a song?
It was a rap song. But I stopped mid-sentence. I realized I couldn't sing it.
You stopped at the moment you heard a tune.
Yeah.
It was like a key.
Off key.
No, it was a key.
Yeah.
You didn't give it time to be off,
No,
Cecil.
no.
You didn't give it time.
I don't really know the words. I just remember I'm from Nassau.
You so don't know the words. Yeah. There's a song. Okay, so what's the song? The lockdown song. Oh, my favorite song, man. I gotta remember. How does the lockdown song go?
Charlie Bahama. Yeah, action man, I'd go. Wait, the whole Nassau lockdown, bro. No, so Rhode Island is the only place to go. Not true, cause I hear they getting locked down too. We on lockdown, and the house is the only thing I walk around. I can't go to the bar, but I pop.
You gotta do the.
Y'all can't hear it? Yeah, y'all can't hear it. Oh, that's so sad.
Yeah, it's a good song, though.
That's the song.
I wiggled.
That's my favorite song.
Yeah.
Personally. I mean, I'm just saying, being on lockdown is legit. All right, hold on.
Charlie Bahama. Yeah, action man, I'd go. Wait, the whole Nassau lockdown, bro. No, so Rhode Island is the only place to go. Not true, cause I hear they getting locked down too. We on lockdown, and the house is the only thing I walk around. I can't go to the barber, so I pop down. And the barber clothes, I so hot now. We on lockdown, lockdown. I feel like Minnesota, I got the gas locked down. Wait a minute, let me see you do the lockdown. Oh, I hot now, Lord, I hot now. Yeah, that's Charlie, an action man, I'd go. I so fresh, but I can't go nowhere, bro. Well, Mado, you were but the wrong thing, bro. Well, you mad that I got money to go Orlando. We later, mate. The gas mad too. The only place I dress up is super value. The beach clothes, you know where I take my gal to. No, boy, I just see some tourists Blue Lagoon. Alright, lock it, alright, lock it right down. Everybody, let me see you lock down. Lock it, alright, lock it right down. Everybody, let me see you lock down. Oh, no. I can't go nowhere. I locked down I can't. We on lockdown, and the house is the only thing I walk around. I can't go to the barber, so I pop down. And the barber clothes, I so hot now. We on lockdown. We on lockdown. I feel like Minnesota, I got the gas locked down. Wait a minute, let me see you do the lockdown. Oh, I hot now, Lord, I hot now. This is curfew vibes.
And let me make sure that we're on par today, because I had this picture going on in my mind as we are getting closer and closer, Cecil, to D-Day.
D-Day, Wednesday?
No.
Because I told a press conference.
2020.
2022.
2022.
Oh, okay, something different altogether.
Yeah, totally different. What were you thinking about?
Well, I thought there's going to be another press conference in Russian
No,
Square.
they don't even. Oh, God, that one.
Yeah, that was Russian Square again.
Oh, for
They're
God's
going to
sake.
just rehash old things.
Oh, boy. You know what? I try to be supportive.
You do?
I try.
You did?
I try to be supportive. Good. I try to be supportive.
So what happened?
And it has to make sense, man.
Is you trying to say it doesn't make sense?
I'm just saying that.
I told you initially it didn't make sense, but I mean.
But no, you always on this. Nothing makes sense. Life.
Yes.
Right.
Yes.
And I don't know. Your Pan-Africanism sometimes is questionable.
Eyes free. That's why you're still in bondage.
You know what? You might be right.
Y'all are.
You might be right.
And I'm the crab outside looking at you. So what y'all doing?
Hold on. This is powerful.
Yeah. Profound.
You're the crab outside the pen?
Outside. I'm one of those
so
crabs.
You've never tried to throw like a twig or something to help me get out the pen?
No.
You a petty crab.
No. When you're free, you stay outside.
You're just petty.
I'm not like that lady who's go back into the plantation to try to free other people.
You're not Harriet Tubman?
No.
You're in Wakanda forever?
No.
I know
Since I is free now. I is free.
Ah.
I got to stay outside in the bush.
No. I wasn't worried about the D-Day March. Man, I could find a song for that one too, mind you. I could find a song for that one. But I was thinking, this is where my mind is at right now, right? As we are getting closer, Arlie, and then there's some. Arlie, I wanted to be a surprise. Check your WhatsApp. Okay, this is where I am right now looking at this as 2022 rears its head, and COVID-19.
Is it 2022 for the election or 2021 New Year's Day?
No, you New Year's
So
Day.
you talking about
way down the road.
General
Because
election.
Actually, I think that the election might come
Early, yeah.
It might be 2021.
Easy.
I actually know folks who are very much preparing for a 2021 election call, but I don't see how that's going to happen personally.
You don't think so?
I
think
mean,
at least October.
I mean, anything is possible. Right?
I see people giving out free vaccine, not vaccine,
free antigen
tests,
and that's what
clearly
gives me
election
season is coming, right? And I think that the Progressive Liberal Party is preparing as if election season is coming. I think the Free National Movement have really spoken.
Yes,
they've given away too many clues to try and make it this sort of, obviously it's coming in 2022, the latest, right? But that something is afoot.
Yes,
right. Something is afoot. Says don't be no crab, Cecil.
Don't be no crab. How about black crab?
Don't be a PLP crab. That's what they're worried about.
Okay,
don't be a PLP crab. All right. So there was this. I envision now at a certain point, and I've been looking at some of the things that the administration has been doing.
Yes.
Right. Something came across my desk, and I thought, oh, that is so nice of them.
Nice.
Right. And I'm trying to think. I can't remember exactly what
one of those grants for women. Women get a lot of stuff.
Grants. Well, the SPDC got to still explain why people are still having a challenge connecting with them. Like they've done the online, but no response. So SPDC has to fix that problem. And I'm going to try and get them on again to tell us why. I've tried it myself. I've registered just to see the process.
I enjoyed that show, actually. I felt enlightened to say, wow, possible to get.
Well, I didn't sign up online. Ain't nobody reached me yet.
No, not at all.
No. So I'm going through this process intentionally.
You tried to do that woman one where they're giving women all the free money?
Listen, it shouldn't matter. Just the process is automated. It should work to an automated spot, right? You know what I'm saying? So I feel as if this is what's going to happen. So we see now, but Chester Cooper's working for his constituency.
Yes.
Free antigen tests.
Yes.
Very good. Shout out to Chester Cooper on that.
Mm-hmm.
I'm sure Ragged Islanders. No, he didn't mention Ragged Islanders.
He did not mention a test for Ragged
But
Island.
it's only like 10 of them in Ragged Island. So I guess you don't need to necessarily mention.
Catch a ferry over.
You just go over and give them the tests and boop there it is. But I would have mentioned it.
Yeah. But if I was from Ragged Island, I'm not even coming over.
No, I wasn't going over. You come to me.
You come to me.
I ain't got no airport really, so you come to me. I wasn't going over there. But there was a thought that, you know what, people have already started doing the door-to-door thing, right?
Door-to-door tweet.
Like campaigning door-to-door.
I see the Prime Minister's in Abaco, one of those keys.
Yeah, Grand Key.
Yeah.
Talking about he's going to give this antigen test.
The
vaccine.
Yeah.
I have a song. Do you know Solo got a song for that? Already? I can play that song for y'all too. So this was the song that came to mind when they come to the door. This is the voice I'm hearing of every party. PLP, FNM, DNA. Who else?
The
KGM.
And the Christian party. You have two Christian parties now. Religious people love politics now.
What's the name of my girl's party? The Christian Bahamas Constitution Party.
Constitution Party.
Yeah.
That's our girl.
Okay, so did I say? Oh, that's right. Can we talk? Can we talk? That's the one, Arlie. So this is how they're going to come to us, right? They're going to come with smooth words.
Yes.
And they're going to sing this particular song.
Go ahead.
And Arlie, are you ready with this song? I took too long to give Arlie the song.
You should.
You ready? You ready? This is the song that they're going to come to us with at the door, at our door.
They're going to knock?
Man, wait, I got something for when they knock though. But Arlie, play the song. Play the song, Arlie.
Soothing.
And I feel like I feel this one. And I can hear the smooth voices of imagine Ellsworth Johnson. Yes. I can hear his smooth voice with this song. I feel like I can hear with the bass.
I love Ellsworth's voice.
Shannon Dawn.
Smooth.
I feel like Shannon Dawn could sing the song for me.
Can we talk?
Wait.
No. You gotta wait for the preamble.
What did he do last night, Shannon Dawn? Standing by my water pump. And what you started doing?
As a speaker of the house.
He started pretending that he knew me.
Yeah.
And I knew him too.
Say, I see from long time. What'd you say, cousin?
But just like this is Shannon Dawn. Ellsworth. What did he say? He was shy too. This is when it gets good.
too excited about this.
Barnabas. You can imagine Denisio singing this. There's people. He's building up his confidence.
That's what it is.
Next time he comes my way. Hey, what y'all gonna say? Political parties. What you gonna say? No.
We're about 4 minutes.
Maybe. You got a box? What in the food box? Right? So I felt like and the next song, Arlie, check your thingy. Right? That's the song.
Yeah, I like that song.
And I feel like they should all come with that song. It should be smooth and mellow. Right? And I like this one. I started to write you a letter. Because I wanted to be more clever. I feel like if anybody else feel like their politicians can sing their song, I feel like this is a song of champions.
I could see Lanisha coming to Sea Breeze with that song.
I like that song for Lanisha.
Yes.
And she want to get down and sweet talk us.
Yes.
Right?
Let's talk. Come here.
Come.
Let's sit down.
Right? But I think what's going to happen, Cecil, you ready for the next song? It's going to be a lot of this. Right here. Ollie, let her rip.
Who let the dogs out?
How does it? Oh, you were setting the dog. That sounds very over the hill type vibe.
They can come to the gate, Cecil, and all they can hear is, "Who let the dogs out, buddy?"
Do you know that there's no barking inside the song?
Don't do that. I already heard that, and I refuse to accept that. They were barking.
It's not who let the dog out.
Every romantic interlude of a politician come to your dog. Everybody should let the dogs out.
Let the dogs out.
Who let the dogs out? No, they didn't say who. They say Roo. Someone says I want to dedicate. Can we talk to Dr. Berceli and Dalrita? Get back, Scruffy. Get back, Lanisha. Get back, everybody from Model. Okay, so, because that was what I was saying. I'm thinking at this point now, I wonder how many people are going to get politicians to actually show love.
I think that this campaign season is going to be tough.
I think it's going to be fun. I think it's going to be fun more than tough.
An environment where people are begging outright. It's not, you should, not what you do for your country, what you can do for your country, but what you can do for me. I want something.
What you
Things
want?
are tough.
What do you want?
I want to buy groceries.
So, okay, give me a song where buys grocery.
I don't know, but I just want to buy a grocery. I want things. Christmas coming, and I expect for the child to get a gift. The politician needs to come around with a gift or ham and turkey. That's why I miss Miller. I miss Leslie Miller because I could show I need to get a piece of ham.
It's going to be this is going to be a crazy season, right? As what has to happen in this next year and a half is going to be difficult. It would have been difficult for any government.
Yes.
And unfortunate for this administration, this is their lot.
Yes.
This is their lot, right? They're going to have to figure out how to get people back to work. And it actually is so interesting because I remember when V. Alfred Gray said it. Remember V. Alfred Gray got excoriated for it, and I still can't stand that he said it.
All you got to do.
Listen, all you got to do is give to 2,000, 3,000, 4,000 jobs, and the people will vote for you. They just want jobs.
Yes.
Right? They want income. They don't necessarily want these types of jobs. We want income.
Independency.
Right? Independence. Yeah. And so what he was just talking, give them any sort of thing. Give them anything and they will be happy. This administration has to figure out how within the next 18 months, how do we stop the hemorrhaging?
They're bleeding a lot.
How to stop the hemorrhaging? We've suffered another downgrade.
Yep.
Right? We're further junk. We're like junk minus.
Junk minus.
Right?
They get as many downgrades as the PLP. I thought the PLP had a record.
Man, listen.
Now the FNM is close.
Isn't this deeper than the PLP?
Yeah, it's never been the junk.
We've never been here.
Never been
and we're minus junk.
Yeah, minus junk.
Yeah. We're minus BB now, right? On Standard & Poor. And Standard & Poor and the S&P says that, listen, if we don't see a particular headroom or progress by 2021, there could be further downgrades.
They could go lower than low?
Yes. Because this isn't the lowest, eh?
No, I guess not.
This ain't the lowest. So this administration is going to have a challenge. And one of the things that has been pushed by these entities like Moody, like S&P, by IMF, World Bank, is tax, a shift in or change in the tax regime, moving from VAT to income tax?
Well, I believe a number of Bahamians will welcome income tax. They believe there's a very anti-rich people at this point in our culture. And,
Well, I think it's equitable taxation. The VAT on the lower income hurts you more than VAT on that. 15%. I always say it's a valuation of the power of your dollar.
Yeah.
If $100 in my wallet is a common stay, if I always can walk around with $100 or $200,
yes,
I'm considered far more successful than a majority of people who working to get $100. Like that's resting money. Some people got a resting $20 always in their wallet, or resting $50 in their wallet. That's a resting thing. It doesn't, no matter how their wallet sits, at minimum there's $50. At minimum there's $100. Some people got so much money they just leave with $200, $300, and the rest is debit. But that's their resting amount. I always say if you could check somebody's wallet and see what their resting amount is.
Tip money.
Yeah. That calls your everyday dollar. That's your walking around. That tells you, okay, how much do you spend when you go out on a given day? You go to the store, you don't spend $100 on food. No. You spend $200 on food, or the cost of food doesn't phase you. So you could go to the high end food store, and what would cost someone at a Rupert Roberts food store $30. When you go to a high end food store that costs you $55, and you're not phased. That's a different level of money.
Yes.
So VAT doesn't affect you the way the person who looking at tuna and corned beef or hot dogs is being affected by it, right? So VAT is regressive because it affects the poor or the lower class, or like you would say, the working class, at a very, disparative or very negative way. And I'll make sure I get my words correctly, so I'll go with that. So that is where the challenge comes. The challenge comes is that if you have more money, if you're successful, $1,000 is no money to you. This is like a regular spend. And VAT doesn't do anything to you. 15% out of $1,000 is what? 15? $150. So what's the point?
Yeah.
I ain't hurting.
No.
So I mean, come on. I'm just saying, income tax would affect people with more money differently.
And I understand that, and we'll see how that pans out. I mean, if this administration is brave enough to even start that conversation.
I don't know if anybody's brave enough. The PRP was never brave enough.
And then I wonder how that impacts heads of agreement. I'm sure. I do not know. What if a number of heads of agreement has that you won't have any income tax? How does that impact that? You changing the law.
And I wonder, can you go back on income heads of agreement?
Well, they have clauses inside the heads of agreement.
I think would you be able to go back on it? If you're able to go back on it.
You came here as part of the package of not having any income tax,
capital gains tax,
and stuff like that.
I have I'm looking forward to this week of shows. Tomorrow with Anthony Audley Thompson, we're talking about the history of taxation in the Bahamas.
Nice.
Right. So we know he's a noted economist, historian, and author of the economic history of the Bahamas. So tomorrow we're discussing the economic history of taxation. What forms, varying forms that has it taken.
But will he break it down? Because a number of Bahamians would say we don't get tax. They have experience tax.
That's why I wanted him to do it.
That's the only tax they know about.
Oh no, that's why I'm happy that I'm doing it with him, because he goes through and I think you've seen me with his book many times.
I saw the book.
The history of the Bahamas.
I remember when you just told it around
all the time, man. Yes. Listen, and I loaned it out to one prominent lawyer.
That's what it is. You don't lend Negro things.
Man, look here, man.
Now you learn. And how long you let it out?
A little while now. Little while.
You call his name.
Charlie is a QC, but it ain't that one, y'all. Everybody know.
Oh, okay. But it's a QC all the same.
QC. It's only like 10 of them.
Yeah.
So deduce.
You'll never get that book back.
I gotta let that go to God.
Yeah.
That book finished. Yep. And it got my name in it too.
Have your name too? So he knows it's yours.
Well, I'm just
saying.
saying.
Every time he opens it.
Property of.
Yeah.
Right. Anyways, we digress. So anywho, we have that I'm looking forward to that discussion, because the question of taxation is a big one. How are we going to, what will we look like in 18 months? That is, I think, the biggest question that this administration has to answer is, can they, along with every other party, and I think that's what's big for me. That's why when you walk to the door, when we say, can we talk? If you're not talking about how to get us out of this economic quagmire within the next 2 to 3 years.
Yeah.
If you don't have that as a real, not ERC recovery document. No, we're talking about strategic planning. How are you planning on getting us out of this?
This is why the natural resources conversation is getting prominent and loud, and the drum is getting louder. That Bahamians are so desperate that they're willing to entertain anything that would.
No, the natural resources thing is not a desperation conversation. It isn't. I think it's a one that's long overdue.
It's not even a conversation of what can we get and how can we get it anymore. It's a conversation that each Bahamian will be millionaires overnight.
Which is fine. I don't mind that. I don't mind.
You don't mind that conversation.
I don't mind any form of conversation at this point about looking at it.
It reminds me of that Derek Roll Billions.
Well, listen.
Yeah.
Yeah. Okay.
Yeah. See,
I don't think it reminds me at all of that.
No.
Not even close. Because listen, you can actually ask the question: those who have been in the mining business in this country, the prominent few, have they not been extremely successful? What is their net worth off of it? We're not just talking about.
But then perhaps we need to have that conversation and invite one or two of them here to speak on that.
When you invite one or two of them here, they don't want to speak on that.
They don't speak how much money they got.
No. They don't want to speak on that. I've asked one.
Yeah.
All right.
Yeah.
Maybe I need to ask the two.
Yeah.
And see what he says. Right. And I asked one of them, and there, they got a gag on it. They can't talk now.
So what about one of those informal interviews without any phone calls? Can you have one of those?
Well, those are always fine, man. You know, people want to do those without phone calls. I don't need phone calls. I come from Star.
Yeah. Yeah, that's true. Yeah.
Star, we didn't do phone calls.
Yeah. So you try invite one or two of them and just let's talk. Let's talk aragonite and sand. And let's talk the difference. What is the difference between sand and aragonite and cement?
Yeah.
The limestone thing. And should every Bahamian have access to it? Or if I have the money to invest in expanding such a business, shouldn't I have a right as a Bahamian to say, man, I'll open my own business?
Someone gives a great point, and we got a call on the line. Says, be careful of your income tax. Will be great message. I never said it was going to be great. I said, it'll be different. It might be better than what we have as this regressive VAT taxation. If I make $2,000 per month, they will take $200 from me at 10%. Now you might say, well, that's better than 12% at the grocery store. My question to you is, when have you ever seen the government live up to a promise of zeroing tax to replace it with another? Remember when VAT was supposed to mean no customs duties? What did we get?
We're still waiting on something to come off.
Oh, okay. Very good point. And, it would bring forward all of the questions of government efficiencies, right? And we have an issue with government efficiency. So the government will go right ahead, and I agree with you on that. The government would go right ahead, give us income tax, not decrease VAT.
On top of VAT.
Not decrease VAT.
And say you asked for that.
Yeah. Oh, but we have to do it. It's IMF regulation, right? So listen, I don't stand for that at all. And you know what? Now that this person brought it up, I can't trust nobody.
No.
We got a call on. Do we have a call on the line? Caller, you're on the head back. Welcome.
Yes, good evening, Aja, and to your co-host.
C.A. Nuri, yes.
Yes, Mr. Nuri. I am here thinking about what you guys just said just now about the income tax and stuff like that. I'm from the inner city, and here it is that you've got a sitting government that is remodeling a park and telling us that this is where he's from. And he's doing it for us and stuff like that. Well, that's what we hired you to do. Would you want a bonus for it? Because we hire you to manage our money for us. You're not doing us any favor. Okay? And then you wouldn't mind if it was a bushy area or a place where there's a lot of houses. You knock it down and build a spanking new park. But you didn't do that. So this is the mind of the inner city thinking. Okay, and yes, Travis Robinson is a young man, and we love that. But what we see you doing to Travis Robinson is using him, because when he was really fighting for the people, you fired him. Okay, now it is you see we've got all our blinders off now. Okay, and you want a second term. Okay, but you say you don't mind if you lose, you're working for the country, but we don't believe that. Okay, Trump gone and you gone.
Oh,
that's your buddy, okay?
Trump gone and you gone.
One more thing before I go. It's been almost make 4 years. You borrowed more than $4.5 million and about to borrow more. Billion. Okay, what the world? What the name of Jesus did you do with that money?
Boy, I tell you, that's one thing. That's one thing that they're going to have to definitely answer about.
So yes,
that's the most. Annie, thank you so much, caller. I appreciate the call.
Yeah, but
hey,
what is amusing too, though, when the F&M, our administration, does things like that, people call it a mistake. But if it was the PLP, they would have called it corruption.
Yep. Oh yeah. Now, mind you, you're right on that. I will tell you the tone.
And this thing is wrong. Okay, that's like white collar crime handled so gently. Okay?
Thank you, my brother. I appreciate it, man. I appreciate
You had a cabinet minister sitting inside the cabinet, and you all gave him a whole post office. That ain't corruption.
I appreciate you, buddy.
Spin. That's what spin you.
Yeah, that one gone way.
Yeah, no.
That one.
He tried.
That one flipped. That one flipped the script.
But definitely, this administration has a lot to answer. We're not disputing that. And
how is it though that they've seemingly been unscathed? I remember, and I think this has to do with how good the parties are at spin.
Yes.
Because the Free National Movement had a cadre of the late chairman of the Progressive Liberal Party.
Late chairman
Roberts.
Bradley Roberts.
Bradley Roberts.
Okay.
Bradley Roberts was supposedly the man with the garbage can. He had nothing compared to what the Free National Movement had on them. At this point, there should be some sort of spinning, and the Progressive Liberal Party hasn't spun anything. It just
and they would have to answer that. And see, it's easy to bash the F&M administration because it's easy to bash the government because they're in power and everything would happen recently. But Bahamians have not forgotten how they felt about the last administration. And we're going to hold that juxtaposed, the F&M and the PLP juxtaposed to each other and have to make a tough decision on whether the F&M did
this administration is worse than the last.
You think?
What?
Yeah.
What?
I know if they could do a landslide like how PLP could do a landslide.
I don't think so either because
it can't be worse.
No, and I don't think it's. I don't think it's going to be a landslide because of worse or that measure of saying, well, a landslide is an indicator that this administration isn't worse. No, I don't think that's it. I actually think that there are going to be far less people voting in this election.
And people say that, but every year our election numbers tend to be high. We always in the 90%.
You know what gears us up at the end?
Yes.
How good the political machine gets us to hate the other guy.
And that's happening now, eh?
I think we're at a place that personally for me, I don't hate this administration. It is what it is. I mean, listen, it is what it is. They are who they are. They are who we thought they are, and we let them off the hook, right? They are who they are. We are the foolish ones who elected another administration who we knew wasn't different from the last guys.
Yeah.
So this is our lot in life, okay? Poor management. People say, well, but what about, nobody expected Dorian. Nobody expected COVID.
No.
But look here, it ain't about the unexpected. It's how you react to the unexpected.
Yes.
That is leadership. That is when you are defined as a great leader or as a terrible one. That's when we have regret or we rejoice. The Bahamian people have regretted their decision.
No, she's going to preach now.
Yes, you caused this.
Yeah,
you
no,
caused this.
I realize
the Bahamian people have regretted their decision from 2017 when the promise of no VAT increase was immediately the betrayal from that.
Rescinded.
Man, listen, that was a serious betrayal.
Yes.
That was a serious betrayal. And I'm sorry, if I wouldn't stand for it with the Progressive Liberal Party, you think I'm going to stand? So I don't think that we hate, most of us who are non-political hate them. We know who they are. And a lot of people, I believe, will not show up to vote because we don't care. It ain't like at this point, who running for us? Who is helping us?
The Kingdom Party.
Well, I know that Kingdom Party might actually have better answers so far, just to say this clear.
Yeah.
KGM, led by Dr. Kevin King, has made more sense,
my Lord,
than any of these other parties.
I'm now concerned about you.
You should be concerned because I am concerned as well.
Yes, I'm starting to sweat.
I am very concerned that I'm saying this out
saying it
loud.
out loud on public radio. Lord.
But they're the ones making more sense.
They're making sense.
They're making sense. And mind you, they still got a lot of things to answer because there are a lot of big statements, right? And some of the things that I've seen in the background I'm intrigued enough. No other parties made me intrigued. I'll give you that too. So they're intriguing. Some of these questions I got like, where you getting all this money from? But see, we ain't got no finance campaign reform. So we don't, when we ask the PLP and F&M where they get their money from, somebody say NIGON, somebody say the similar, So
NIGON ain't here no more.
Well, listen, they can miss him.
I think Uncle Brent won't be here long. I mean, in terms of being a part of the party.
Being a part of the party was just something. I feel like that was a mission.
That was a mission.
That was a mission.
Mission completed.
And I feel like he got it mission done.
Yeah.
I feel like he hit the dark side of the moon.
It won't be as much money.
sidewalks always got to make.
Yeah.
So I mean,
you got to come to me. I own the cement company.
Well, that's other people who own. Yeah, but that's true.
Yeah, so
Very good point.
I know
Real. There you go. Yeah. Seven says, real, like when old boy installed them red 1950 water crank pump and try convince people it was revolutionary.
That was a nice pump, but just it needed some filter because the water was kind of poisonous to the.
The water was deadly. The water was deadly.
But I told him thank you all the same.
I appreciate them pump that'll kill us.
Yeah.
But give us easy access to that water that'll send us all.
Water shortage.
Yeah. Okay. All right. We'll take a quick break. You're listening. Actually, should we? Or do we still have the caller on the line? Let's take the caller and then go to quick break. Caller, you're on the hit back. Welcome.
Yes. Good evening, Nahaja. Good evening, C.A. Nui.
How you doing, buddy?
C.A. Nui, thanks for the laughter, but Nahaja was making some jokes earlier when she had the doctor on. I love the lady. She was sincere, but she's not disclosing the full picture. First of all, she didn't disclose the fact that the flu vaccines of mercury is disguised as thimerosal and aluminium along with a host of... See, if they discuss the ingredients, and we just have nobody to look out for us. I'm sensing an unfreedom of the press because you didn't finish read the text, right? And so what's going on now is in Canada, they passed a law where 11-year-olds, as young as 11-year-olds, or anyone who's even younger than that and able to understand what a vaccine is able to take the vaccine without parental consent. This is a big thing going on in Canada right now. You could go and fact check it for yourself. Mm-hmm. And so the thing is, the reverse transcription of the mRNA, and they're not talking about the nanotechnology part with the
I gotta go to a break, so I want you real fast for me, 45, real fast for me.
You're discussing a lot of things. It's just pure disinformation out there. You know what I mean? You're not going to get it. You need to educate the public.
Thank you, my brother. I appreciate it. Well, I mean, I need to educate the public.
I say, I echo the commissioner, please.
It is what it is.
It is what it is.
Still, even take a break. You're listening to the Hit Back with Nahaja Black. Boy, are you going to take the vaccine, Cecil?
Of course.
Just like that.
Just like that. COVID is killing you.
COVID is killing you.
I don't have no problem growing an extra arm. I don't need
small things. Who needs? But I mean, extra arm it could be useful.
Yes. I just want a full arm, not a piece. I've seen movies where they have a piece of arm growing out.
Yeah, that one isn't helpful.
Full arm.
Yeah, that one isn't helpful.
So I have no problem taking the vaccine. I should be like in the first 50, easy.
I believe you will be.
My concern is whether I want an American vaccine, a Russian vaccine, or Chinese. And that's what I'm debating now because I have to decide, and I want the competent authority to tell me where this vaccine comes from.
We'll take a break. Yes. You're listening to the Hit Back with Nahaja Black. Cecil is going for, I think you would, I would say go with the Chinese one.
Go to the Chinese one?
I say go with the Chinese.
I go to Chinese.
We'll be back right after this. You're listening to the Hit Back with Nahaja Black on Guardian Radio 96.9 FM.
Seeing double may not be a bad thing, especially when it's double points from Fidelity Bank. From November 1st to December 31st, you can earn double points every time you use your Visa credit or prepaid cards. That's double the freedom points for merchandise, travel, and shopping. And if you shop at a local merchant like John Bull, your double points are, you guessed it, doubled. Use your Fidelity credit or prepaid card from now through December 1st and see double. Fidelity is double good for you.
Cancer is smart. It pushes us. We push back. Challenging conventional thinking. Finding smarter solutions. That's what makes Cancer Treatment Centers of America one of the leaders in precision cancer treatment. Using tools like advanced genomic testing and immunotherapy to bring more options to our patients. Cancer Treatment Centers of America. We're not just fighting cancer anymore. We're outsmarting it. Visit cancercenter.com/outsmart to learn more.
This is Guardian Radio, 96.9 FM. Fresh news, smart talk, all day.
And we're back. You're listening to the Hit Back with Nahaja Black. I hope that everybody's doing well. We're taking care of ourselves and that you are enjoying your day. Listen, Love on yourself. Be good to yourself. Be kind to yourself. That's very important that we do that in this time. COVID-19 has definitely changed the way we behave. All of my Biminites, y'all who's at that party, whoop, there it is. Y'all should never let anybody come to your party with a phone. Like, that's just a rule, okay? A rule. You can't trust nobody. But I digress. We were asking the question during the break. My good friend C.A. Nuri joining me today. We are live in studio, the Guardian Radio 96.9 studio, just a change of scenery. Arlie looks like he's COVID-free, but I don't trust nothing.
No, that's
right?
why we stay in that 6 foot.
Yeah.
You know?
And you from Fox Hill. So
Yeah, Odis.
yeah,
Odis.
you know what I'm just saying.
Yeah.
Things a little suspect around here.
Yeah, but the number's going down.
Yeah,
I
no,
should be
hey,
kind of safe. But
the
the
numbers
good
are
thing
going down.
is the wife had to take a COVID test this week. When I say this week, today is what?
I don't know.
Today's Tuesday? Monday, Tuesday? Monday. So she
Monday,
took it like
Tuesday.
Friday.
Why isn't today Tuesday?
I don't even know the days.
Oh, for God's sake.
Everything's
Why
blend.
isn't today Friday?
So she had to take it for work. you
And
know?
she's good?
And she was good. So when she's taking it, I was paranoid. So Lord, if the wife have COVID, then, you know. So, but the idea that she was COVID free, I'm able to wear my mask with pride now, saying
we're COVID free.
We COVID free.
Well, my baby had she had this little cough, so we took her to her doctor, and she got a COVID test as well, and she's COVID free, man.
Oh, so you should be straight.
My whole house, we're good.
Yeah.
Yeah.
But when last you going to the food store?
I don't do that thing.
Okay.
I told you we get our stuff delivered.
And so you did
Yeah,
say
we
that.
don't do that.
You did
I
say
don't
that.
do
You
that.
did say that.
I don't do that. No. Could deliver my food, please.
Yeah.
Yeah, and the fellas drop it off outside.
Yeah.
Yeah, man.
Yeah.
Yeah. And see, that's why I like tech.
Tech is
I
good.
like tech.
Yeah.
More businesses should, just jump out on tech. And then there's a delivery guy. I think there's actually a company called the Delivery Guy.
Yeah, I saw that. Now I deliver food.
Yeah. Okay, so question for you.
Go ahead.
You said you're going to take the vaccine.
I shall take the vaccine. I have no problem with taking the vaccine and being one of the first.
Good. Everybody should it be like one of the first 100s? I feel like okay, you're going to be one of the first, and I want people to know
Yes.
that I support you with being one of the first.
I appreciate that.
I got you.
So I need someone to encourage me while they're walking up. Call me up and
I'll call you.
go ahead, Cecil.
I'll call you.
Yeah.
And we'll do it FaceTime.
Yeah, we can do it.
Right. Where's your family going to be?
I guess I don't know because the wife hasn't decided that she's going to take it.
No,
She said, I
we'll be
just
like,
admit-
hey, someone got to be around for the kids.
Yes.
So I think that she should not get it yet.
Yeah.
Right.
Yeah.
Right. And you should get it.
If I get the vaccine, will I be able to go in the food store without a mask
Well, if you catch COVID, then you won't have symptoms.
because I have the vaccine?
Right. But
So
I don't know if you'll still be able to give it to folks, but I know for sure you can still catch it based on what they said with Pfizer.
So why are you taking the vaccine for?
You just won't get sick.
But I could catch it still.
Bam.
But I'd be asymptomatic from that.
Really, everybody, they just want us to be asymptomatic.
So I might could give it to people still?
Those who don't have the vaccine.
This get more complicated. I thought I could be maskless. But this mask thing ain't working well.
That's what Fauci said. You still have to wear a mask, eh?
Yeah.
Well, what's the point of the vaccine?
What's the point of the vaccine? This is
I'm
not
trying to get
convincing me
out
at
of.
all.
I'm trying to get out of mask space. Like the mask is much.
Mm.
Someone says, Mrs. Black, COVID-19 was a spark on a powder keg called the Bahamas, loaded with sick people with diabetes, hypertension, and obesity. What the heck we expected to happen?
We know that. And that doesn't change anything. We won't change our diet because our diet is cultural. And in order to change culture, they said the only thing that dictates the culture is law. So we may have to enact some laws to make it more expensive to get cigarettes, make it more expensive to get sodas, make it more expensive to get candies and chocolates. That if one chocolate bar costing $15, I will stop eating chocolate. Move on. If a can of Coke is $12 to get, I will stop drinking Coke soda.
Easily.
Well,
and that's why, the generic foods, they're easy to replicate. They do it that way so they're cheaper to mass produce. Organic or, not necessarily, or some organic food don't mean it's great, but it is more expensive to be healthy. And that's why, weren't we promised bread basket items that would have healthy stuff in it?
Yes.
Did that?
Did
that ever happen?
No, it did not. Corned beef is still on it. Remember, they're going to take off corned beef. I mean, I'm glad.
But we said keep your corned beef, and they gave it to us anyway.
Yes, and it's part of the bread basket. It's going to take it off, and in fact, in the bag that the government gives out, the food security thing, you get with 12 cans of corned beef. They try to kill you, but that's okay. I digress.
They really try.
They give you all the salty stuff, processed.
Everything's processed.
Everything is in a bag
Everything
processed.
is processed. You're getting white rice.
No.
Did we get oil? Did they get oil?
Yeah,
in
they
it? You
get one
cooking oil?
generic brand.
I guess sunflower.
I don't
No,
even know.
sunflower isn't generic.
Yeah,
Well, I don't
this is
know.
a generic. It's one of those Asian ones.
All I know is that food basket thingy is not a healthy bunch.
It's aimed to give you cancer.
Yeah.
Clearly. Yeah, it's objective.
If you were, and considering that you're locked down or you're told not to move about,
Yeah.
you're eating all of that and you're sedentary.
Mhm.
God help you.
On the bag, I see they think have a cancer warning on it now. This bag contains, Surgeon General.
Does it say?
No.
Someone says dark chocolate is good, very good, and it's bitter. I like that.
Damn dark chocolate.
Yeah,
aren't I?
but nobody said you.
No.
Okay, we're talking about dark chocolate.
I'm not really bitter though.
Someone says this vaccine you guys are talking about, is your guest saying if you get the vaccine you'd be immune to contracting the virus?
That's what I'm asking. I didn't
No,
say
no,
it.
no.
I'm
No,
asking
no.
if you.
You were asking that.
Yeah, I was asking.
No.
Oh no. Then we found out. No,
You're not
can still
immune.
get it.
You're not immune to
still can get it.
contracting the virus. You can actually still get the virus.
That don't make no sense.
Yeah, no, I think you. So yeah, you're funny. They will drink homemade Coke soda.
Oh Lord.
Oh well, look. All I'm saying is, with all of this that's going on, I fancy that we are going to be asked to take.
Mhm.
The vaccine is coming.
The vaccine's definitely coming.
I still have my concerns on whether or not I need a lot of y'all to take the vaccine first.
Can health officials refuse to take the vaccine? Like nurses, the nurses union active.
Yes,
They
of
active.
course they can refuse to take the vaccine.
How can a
Every
nurse
human
say
being-
they're not going to take
Every
the vaccine?
human being can refuse to take the vaccine, regardless of your job. Now, will it cause concern to someone like me if doctors and nurses decide not to take the vaccine?
Yeah, and they won't give it to me.
Now, you know what it'll be, I think, which is very important. I think all of our elected officials, if they believe in it so seriously,
Yes.
should be the first to do it.
Ministers need to be number one.
He has to lead.
Yes.
He's a leader, right? And we need to see it.
And the Minister of Health.
Oh, but most definitely.
Yeah.
Yeah. And then I would like to see, I would think Pearl McMillan,
Yeah.
she would have to Dal Regis.
Make it a big thing
A
on
huge
social
thing.
media that we all watch it.
And you know how Bahamians go, that ain't the real vaccine.
Yes, no. That's something else. Placebo. That's a
That's a placebo. That ain't it.
Mhm.
I'm sorry. I don't know how you fix this, I don't know how you fix this vaccine narrative. I don't know how you fix it. I don't know how, even if it's good for us, how do you get Bahamians to buy in?
If they give me a free device I'll take the vaccine.
What's the free device? What type of free device?
Just to get on the internet. Like, everyone getting free device now. Government getting free devices every day.
To get on the internet?
Yes, for school, homeschooling.
You would take a vaccine.
I've taken it for free anyway. So, I mean, you might as get it. Well,
Might as well get
get a gift.
something low
Get a
budget.
gift.
So with like a 1-year subscription.
Yeah, internet. Work something with Cable Bahamas.
Okay, well that's not going to happen.
No?
But I mean it's worth a try.
Yeah.
Because you're going to take it free anyway.
Yeah, but it will encourage more people to take the vaccine. I have a plan. I ain't good at marketing.
So a free device.
Yes.
Like a Wi-Fi device.
Wi-Fi device.
I honestly, I think I might take it for like the latest iPhone
Yeah. Or that
or Samsung.
Or that new game that just came
Oh,
out
the
recently.
$1,500
Yeah, definitely.
PS5
I'll take four of those vaccines for that. Easy.
and retail value.
There you go.
Retail.
There you go.
I don't know. Someone says you could get corned beef oil, bread. Oh, you get corned beef oil, bread, tuna, sardine, etc. Yeah, no, I never saw like a whole chicken in the giveaway.
Red Cross gives out chicken.
No, I'm talking about the government one.
The government. Red
And
Cross
is the government one still going?
Yeah, I think that's
The
still
feed
going.
the
Yeah,
people thing. It's
yeah.
good. All right. Yeah. So there's a lot of questions to be asked this week. Like I said, it's going to be a pretty good week. I'm excited about this week of shows. We have tomorrow, economist, historian, author
I'll tune into
Anthony
that.
Audley Thompson. We're talking about the history of taxation, and the reason why I wanted to do that show was because I'm listening. As each downgrade happens, there's a conversation being had, right, on how or why we are viewed this way. And the downgrading, I know people will say, well, everybody's getting experience. No, not everybody's being downgraded, right? And we are in particular, and other nations like us, because we are pegged to the dollar, because our economy relies so heavily on tourism, there are factors that make us less beautiful, right? The government has bonds they need to issue out. How valuable will those bonds be on the market? I mean, are we buying those bonds? Obviously, it's going to be sold to Bahamians and we're buying this bond.
We like bonds.
Right? But one of the things S&P made you question was, okay, the volatility or the strength of the Bahamian economy after a certain period of time. So then you question all of that. They kept issue with pointing out IMF, IMF, World Bank talking about income tax. How does that matter? Why does that matter? How will that affect us? And what sort of history has the Bahamas had with taxation, going through all of its rulership, right? And what is taxation across the board? So that's something that I think is going to be interesting to talk about and to have that discussion on.
No taxation without representation.
I like that.
Yeah, just have to throw that in.
I like
Boston
it.
Tea Party.
Yeah, I thought that sounded good.
Yeah.
Okay. And then on Wednesday, I've got Anku Sarah.
Nice. What we talking about? Religion?
Anku Sarah and I are talking about women as born leaders. Very interesting. My good friend Levin Miller made a post on social media talking about
little sexist.
Yeah, not little sex, very saying that women are not born leaders, right? And as a Christian man, he can't see that because that's not the case, right? So I thought it was very interesting, Anku's position. And so we're going to be talking about women as born leaders. And then on Thursday, we're going to have a discussion with my guest. All of a sudden, I can't remember my guest for Thursday. I was actually very excited about the show on Thursday. Well, I can't remember my Thursday show. And then on Friday, I've got Dr. E, and we're talking again about the phases of marriage. So the honeymoon phase, the in-between phase, the I won't leave you phase, the phases of marriage on Friday.
The 10-year itch.
Yeah, there is that. That's a real thing, eh? Yeah, 10 years was a real thing. And no, sorry. Thursday is Anku. Wednesday, we're doing a show on family law.
Okay.
So for folks who are divorced, how do you get, what the custody battles with children?
Why women always get to keep the child?
And men,
I'm concerned about
a lot of fathers have reached out to me saying, listen, I am getting the short end of the stick when it comes to the rights of me and my child.
They want how I have money, but don't want to give me
They don't
access.
want me to see. And so we're going to have that show. I'm looking forward to this week's series of shows. It's going to be good. So Attorney Robin Lyons will be joining me on Wednesday since she's a family court specialist.
And that's a PLP lady or the F&M lady?
PLP lady.
Okay.
But she's an attorney.
She's an attorney also.
Yeah, she was an attorney first. I would hope.
Yeah.
Right? I'm just saying. You're listening to The Hit Back. C.A. Nuri, my good friend. Special thanks to Dr. Susan Williams Lockhart, everyone. Have a great day. We're out.